You are live.
Great. Okay, let me get started then. Good afternoon, everyone. I wanted to give a quick update on what's happening in Sonoma County with our coronavirus cases at this time. We've done a total of 2,484 tests, and we have a total of 115 cases as of today. 84 of those cases are active, 30 have recovered, and as you know, we've had one death. I also wanted to tell you about what's new in terms of our guidance. Recently, we put out a health officer guidance on face coverings for general public in all age groups. And I want to go over this guidance to help you better understand what it is that we would like to see. So we want to protect your community over and above. Ordinary face coverings have not been proven to protect the wearer. When worn by someone with COVID-19, however, they may reduce the risk of spreading the virus to others. Since not everyone with COVID-19 knows that they are sick, wearing a face covering helps. Make sure that you are not unknowingly affecting others. If worn by everyone when outside the home during essential activities or when going to your essential business, this can help slow the overall spread of the virus and keep our community safer. So again, it doesn't help you from getting infected with COVID-19. However, it will keep the community safer by decreasing the chance that you might actually infect other people if you're asymptomatic and potentially have COVID. Anyone who knows that they have COVID-19 has been exposed to the virus or who's experiencing symptoms associated with COVID-19, that's fever, cough, shortness of breath, sore throat, should remain home and follow all isolation and quarantine directives from the county health officer and their medical provider. You can find this guidance on the CDC COVID-19 website. You should also protect your medical providers. Use the best face covering that you can, but save purchasing new surgical masks and protective equipment for professionals. Our doctors, physicians' assistants, nurse practitioners, nurses, paramedics, and other healthcare providers are bravely working through this emergency to protect the rest of us. To do so, however, they need personal protective equipment, and supplies are limited. Surgical masks, unexpired N95 masks, and other essential protective equipment is not recommended for everyday use for everyone in the general public at this time. If you have unopened N95 masks, surgical masks, or other protective equipment, you can donate them to the county through Salvation Army. You also need to protect yourself. Please follow all the guidance on the use of face coverings and continue to use social and physical distancing. Face coverings are only one small part of the overall effort to slow the spread of COVID-19. Everyone should continue to stay home except for essential activities and to take every precaution when going out, including frequent hand washing, social and physical distancing of 6 feet, and other appropriate measures. Please read and follow the guidance on the cleaning, fitting, and use of face coverings that's on the website. The health officer will continue to closely follow any changes in this topic on a daily basis and may update this guidance in response to any future state and federal public health authorities' recommendations. A quick word on face covering usage. A cloth face covering is a material that covers the nose and mouth, such as a bandana, scarf, neck gaiter, or homemade cover. It can be secured to the head with ties or straps, or simply wrapped around the lower face. They can be made of a variety of different materials. You can use cotton, silk, or linen. And a cloth face covering may be factory made or sewn by hand. It can be improvised as well. You can use t-shirts, sweatshirts, towels. There are patterns on the website in case you want to make your own face covering. So when you use the face coverings or homemade mask, it should only be worn by one person. It should be fitted carefully to prevent frequent adjustment. You should be really careful about touching surfaces and touching the face covering. Strict hand washing before and after touching and adjusting the face covering is very important. And you can wash it frequently, ideally after every use or at least daily. If you must rewear the cloth face covering before washing, wash your hands immediately after putting it back on, avoid touching your face. And discard the face covering if it no longer covers your nose and mouth, if it's stretched out or damaged, or it has holes or tears in the fabric. So continue to use physical and social distancing at any time when you leave home for any essential activity or essential business. However, try to shelter in place. We know that shelter in place has been extremely effective in flattening the curve and bringing down our numbers of cases and decreasing community transmission of COVID-19. So please listen to my health officer guidance and orders at this time. Thank you.